So we've had a chance to hear about social accountability, and we've also heard some provocative thoughts around how we embed generalism in both undergraduate and postgraduate training. So now we're going to turn to Mary and hear her thoughts related to recognition and how we can think about the link between recognition and this concept of educational standards and accreditation. So over to you, Mary.
Thank you, Maria. Although I'm here as a representative of the American College of Nurse-Midwives, what I'm going to report is in my role as a co-chair for the Educational Standing Committee for the International Confederation of Midwives, and I'm the section chair of the section devoted to promoting midwifery educational standards. In 2014, there was a report on the state of midwifery in the world, and that report highlighted that midwives were capable of delivering 90% of the essential care for mothers and infants before and after pregnancy, and gave a cost-benefit analysis that midwives were a very cost-effective investment in decreasing maternal and infant mortality. There were 73 countries highlighted in the report. These countries were responsible for 95% of the maternal and infant mortality burden of the world. And so those were the ones that were included. And of those 73 countries, only 4 of them were identified as actually having adequate numbers of midwives to meet the needs of the country's population. About 1 in 4 of the countries had the tools or guidelines were being developed for competency-based curricula, and only 11% had taken steps to align with the ICM global standards for both the competencies of a midwife and the educational standards. And about half of the countries have some responsibility for accreditation of providers, and 70% have regulatory bodies for educational standards. So this is a pretty complicated issue, and the American Confederation of Midwives promulgated the standards, educational standards for midwifery education in 2009 with an sort of an addendum or amendment in 2011. And it was a very long process, Delphi process, to come up with these standards. And one of the more controversial parts was contained in the preface of the standards, which was an agreement on the actual length of education post-secondary school. And there was a general agreement that direct entry into midwifery should be 3 years, and that if you were to do midwifery after prior healthcare education, such as nursing or some other healthcare education, it should be at least 18 months. The standards have 6 broad categories, of which there are 37 discrete standards and 27 subsections. Along with the standards, to ICM's credit, they developed a compendium of companion documents that allow educational program, give examples of curriculum, they give examples of lesson plans, they give lots of concrete examples and resources that education programs could use to meet the various standards. The issue is this conflict between countries where the country organization is actually the accreditor, and so this need to meet the desperate need of the population for somebody to do the provision of care, and on the other hand, the issue about quality, which does take time to educate people. And so we wanted to stay away from the word accreditation, but we wanted to see if there was a need, if midwifery educational programs around the world felt that there was a need for there to be a process in which they could be recognized as meeting these new ICM standards of education. And so the Education Standing Committee among themselves developed 4 simple questions for a survey. And so the questions we developed were, it was we're going to be an internet-based survey so that we could reach a wide audience. And was there a perceived need for a recognition program among midwifery education programs globally? If there was a perceived need, would it be feasible for these programs to be able to produce a self-evaluation report that identified how they met the standards, and if maybe they could do it, what needed resources would they need to do that? We then asked for ideas of how would you verify that the report was true, that what someone wrote was true, and what kind of resources would be required. And we were trying to sort of get some innovative ideas about how to go about that. And then lastly, we asked, did people think there would be a willingness on the part of local midwives to act as evaluators? And recognizing that this is a lot of different countries with lots of different cultural contexts and different ideas about voluntarism and that kind of thing. So we ended up making our survey in the 3 official languages of the ICM, which is English, French, and Spanish. And everyone on the committee participated in that endeavor. And we sent it to various listservs of the ICM. There's a very large listserv called the Global Alliance for Nursing and Midwifery. And then we also did personal outreach to under-resourced countries to try to get as broad a representation as possible. For our results, we were pleased that we got 58 different countries. We got over 200 responses. You can see we did pretty well in the Americas, not so well in Northern Europe, and not so well in Eastern Africa. We're missing some major players in Southeast Asia. Indonesia has a large midwifery presence. We didn't get any responses from there. The demographics, as I said, we had over 200 responses. About 30 people did not started answering it and didn't delve into our main question, so that was about 200 people. Most of the responses were in English. A quarter of them were in Spanish. It was very interesting to me when I was looking at them. Some people started the questionnaire in Spanish or French. They opened that, but the qualitative responses were in Portuguese. So anyway, that was interesting in trying to translate all the qualitative responses. About 16% were from what I would call non-high resource countries. It was evenly divided as to the kind of programs people were educators in. Half of them were direct entry programs, and the other half were post-nursing programs, although there's some countries that have both, so it's a little hard. It's also interesting to note that the program lengths range from 6 to 66 months. So some of them certainly didn't even qualify for the ICM definition of the minimal length of programs, which was an interesting observation. As far as the need for a recognition program, about 80% said they thought there was a need, and that was in both high and resource countries. That was surprising to some of us, that even those in high resource countries that are known to have strong accreditation processes for midwifery felt that they would really like to participate in such a recognition program. And many of them felt there should be a common standard worldwide for midwifery that would help with uniform processes and standards within countries. And I think some high resource countries thought, well, if we wanted to expand our student experience to another kind of culture or setting, we would like to have this know that we're sending our students to a quality setting or a quality program. As far as ability to create a self-evaluation report, 80% said they would be able to do that, but many of them said they would need some help, and you can see those there. Only 20% of people felt there was no need for any further, they didn't need any more resources to do that. For validation, about nearly the same. Well, everyone felt that there should be validation. Pretty much everyone said it should be an on-site evaluation, although a few people did say a virtual process would be um, uh, one way to do it, and so that would be interesting to explore. And a similar percentage said that they would need some sort of resources, and more than 80% thought that local midwives would be willing to be trained as long as they were compensated. So our conclusions are that the majority of educators want some mechanism to demonstrate the quality of their programs, and nearly all of them thought on-site evaluation or validation would be ideal. However, there was a lot of concern about training quality and the ethics of on-site reviewers expressed by the people responding to the survey. Thank you.
Thanks, Mary. And actually, I wanted to pick up in my question on your last point. You talked about the concern about training quality and ethics. So you might want to pick a couple of those or others. But if you could maybe just talk a bit more about a couple of the issues or sort of critical barriers that might need to be overcome as you imagine moving towards some kind of development and implementation of a global recognition program.
Well, I think some of the barriers are, first of all, it would be volunteer. This is a voluntary recognition program, but I think it's financial, really. You have to develop the infrastructure to do that. We were thinking that maybe you could decrease costs by some sort of virtual process. Um, but many people indicated that they would need an improvement of their electronic resources in order to do that. So I think cost is a big barrier. And then I think, you know, in the day of the internet, we could develop a certification, online certification process for evaluators. But evaluating people's ethics is a little bit harder kind of issue, and I'm not sure exactly how we would go about that, although it was interesting that many people brought that up as an issue.